Clinical research in particular is essential, and it's inherent to the culture of children's cancer care. Almost every child with a diagnosis of cancer will be offered a clinical trial as therapy where we compare what we know to be the best therapy that we have available to something that we think may be better, whether it's because it's adding on a new medicine to try to improve cure rates, or because cure rates are so high that we're seeing if we can get away with less exposure to medicines and therefore decreasing our risk for long-term complications. So you will often be offered clinical trials, and we're not looking at making children guinea pigs, we're looking at improving care. And if we didn't think there was a potential benefit for a child, we don't offer that therapy. I myself am doing clinical research and graft versus host disease, which is my area of expertise. One of the projects I'm working on now is looking at, can we develop new blood tests to help us with making a diagnosis of chronic graft versus host disease, because it can be challenging, particularly in our young patients who have lung involvement where we can't do our breathing tests that we normally do. We're also looking at making blood tests that can help us with determining, can we start coming off our immunosuppression for patients at risk for chronic graft versus host disease who are on therapy for chronic graft versus host disease, because it's not clear when is the right time to stop medicines. And what we invariably have to do is say, okay, it looks like things are stable. Let's start coming off these medicines and see if things get worse or not. So if we can make a blood test that can tell us this is not likely to come back up as we're coming off of medicine, that would be a wonderful tool for everybody. On top of that, I'm getting ready to start a clinical trial that's going to be run throughout North America of using what we think is a very safe medicine that's used to treat chronic graft versus host disease in patients that are predicted to be at high risk of developing it, based on blood test work that I've done with a very close colleague named Dr. Kirk Schultz, who's up in Vancouver, British Columbia. So that's something that we're hoping to have ready to go next year. And I'm also involved in clinical trials of using medicines after transplant that can target patients' leukemias if they have specific mutations, to see if we can give ongoing control to try to decrease the likelihood of relapse after transplant, which is often a very high risk and often catastrophic outcome of a transplant when we can't cure it with that transplant itself. So there is clinical trials and clinical research being done all throughout the country. It's always good to talk with your doctor and ask them if there are clinical trials for which you may be eligible or able to participate, to hear what they are, to see if you're interested in participating on them. No one will ever force you to participate in clinical research, but if you're willing to help pay it forward and help us learn how to better take care of children like your own, this is one way to do that and help us move the field forward so we can continue to make further progress and try to get to a time where every child that gets a cancer diagnosis will be cured. So please be open, be curious, but know that you are not required to do clinical research. But we do ask when we think it may be of potential benefit.